Coming up, protecting our bones as we grow older, how doctors can spot and treat weak bones before they break. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Anyone at any age can break a bone, but fractures are more common and much more dangerous for older adults. Today, we are learning why bones get weaker as we age, how doctors measure bone strength, and what role hormones play in protecting bone health. Here with me in studio today is Dr. Jessica Calendar-Rich. She is a geriatric medicine specialist here at the health system. Good to see you.
Good morning.
Also joining us remotely is Dr. Melanie Meister, and she's an OBGYN and the health system's director of research for female pelvic medicine and reconstructive surgery. She's an expert in using hormone therapy to protect bones. We'll talk about that here in just a few moments. We are also joined by two women who are already very active and want to stay that way. Connie Young is in her 70s and MJ Meister in her 60s. And MJ also happens to be Dr. Meister's mother, so we're glad to have this mother-daughter duo here with us this morning. So, Dr. Calendar-Rich, I want to talk with you a little bit about this idea that as we age, bones get weaker. But does it happen to everyone? Is it inevitable for all of us? And if so, what age?
You know, it is inevitable that our bones change as we get older. And really we know that peak bone age is around 40. So even for those of us in our 40s and 50s, we really need to start thinking about ways to help keep our bones as strong as they can. And what happens is, you know, as the bones get a little bit, start to age, the infrastructure of the bones changes, right? And so not everybody is going to get osteoporosis, not everybody is going to have issues with fractures and things, but everybody is going to have changes in their bones.
So they're susceptible. But that age, interesting. 40s. I'm almost out of my 40s. Is it too late then? Or is it never, one of those never too late to start taking care of your bone health?
It's never too late to start doing the right thing and taking care of your bone health. So there's always an opportunity to increase the ways that we are like moving our bodies. You know, I always come here and I talk about moving our bodies. So bone health also has a huge component of how our bodies are moving and how much sort of weight-bearing exercise we are doing.
And weight training is key for bone health.
Weight training is key for bone health. We recommend that people lift weights, and if you can't lift weights, it can be like cans of beans, whatever it is, for at least 2 to 4 times a week.
All right, no excuse. There's something around the house. Okay, so let's look at bones under a microscope. Let's really take a look, because we have one that's on the left side. This is a healthy one, yeah. And then the other one is one that has osteoporosis. So when we say a weak bone, we actually mean less dense?
Right, so our bones are always having turnover. We're always making more bone. There's always bone that's being broken down. That's part of the natural cycle of just bone health. What we see as we age is that the bone ends up reabsorbing more than it's building. And so what we lose is sort of some of that supportive infrastructure of the bone. So it's not that each piece of bone is necessarily less dense, although it is a little bit. It's more that there is just less building blocks there that the bone can depend on.
Yeah, the building blocks, we see them right there in those photos. So what exactly is osteoporosis? And then its precursor, osteopenia?
Sure. So osteopenia is a precursor to osteoporosis. Not everyone will have an identified stage where they'll have osteopenia. What we know is that stage is based on testing and other factors, is sort of puts a person more at higher risk, right? So they're at higher risk for their bones being weaker over time, and then osteoporosis really is when somebody is at a very high risk of fragility fracture. So that's what we're worried about with osteoporosis, really, is that people will have fractures in their bones, right, which may lead to other downstream consequences for their ability to move and their ability to be independent. And so osteoporosis, and we sometimes find it by doing routine testing and preventative health, and other times, and this is what happens most commonly in my practice, we find it after somebody has already had one of these fragility fractures, which means, gosh, I was walking and I fell and broke something, as opposed to if you fall down a flight of stairs, it's really common to break something, right? But if you're walking and at ground level you fall and break something, generally that means that your bones are not as strong as they should be.
So are we all like in a state of osteopenia?
Not all of us.
Okay.
Yeah.
Okay.
So we're not all at a state of osteopenia. There are clear guidelines around who's at higher risk versus others. But what we do know is that being mindful of the calcium intake and the vitamin D intake that you're having in your body, mostly you can get it from dietary means, but also supplements that are out there. And then really that exercise, and also like avoiding smoking, excessive drinking, all of those things are really important.
So a lot in your control. What about not in your control? Is it genetic?
There are definitely genetic predispositions.
Okay.
So absolutely, genetics can play into that. If you have parents and family members that are that had osteoporosis, you are certainly at higher risk, and it's really most commonly women. So men can have osteoporosis. It's more commonly related to hormonal changes that are not common. They don't happen to everyone. For women, we do, and Dr. Meister will cover that, I'm sure, in more detail, but there's hormonal changes really can impact our bone infrastructure.
Right. Okay. Another thing to add to the list of things that women have to keep in check.
I mean,
we can't cut a break,
no.
Right? All right, let's bring in Dr. Melanie Meister. There actually is a way to test bone density, something called a DEXA scan. Doctor, how does it work, and when should a patient get one? When would they know to get one?
So DEXA stands for dual energy X-ray absorptiometry, but it's basically a radiologic test you can see here where high and low energy X-ray beams are sent through the patient, typically evaluating the spine and the hip. And this is looking for bone density, and we generate, or this test results in two scores, a T-score and a Z-score, and these are standardized scores that allow comparison of the bone density across different sites. And so the T-score actually compares the patient's bone density to a young, healthy person, whereas the Z-score compares the patient's bone density to a healthy person of their same age, same sex, and same ethnicity. Typically, especially for postmenopausal women, we really use that T-score more because it's more indicative of their sort of bone density as compared to a young, healthy person. And it's measured in standard deviations. And so a positive number would indicate that the patient's bone density is higher than that of a young, healthy person, whereas a negative score would indicate that that patient's bone density is actually lower than a young, healthy person. There are cutoff values that define osteopenia and then more severe osteoporosis. In terms of when a patient should get a DEXA scan, usually for a healthy adult without certain risk factors, age 65 is when we recommend DEXA scans, although there are some women, especially, who we would consider a DEXA scan earlier in, starting around age 50, and that would be in situations if a woman was very thin, so a low BMI, if she was a smoker, or as Dr. Calendar-Rich mentioned, there are some people who with a genetic predisposition. So if that patient has a family member with osteoporosis or a history of a hip fracture, they might be a candidate for earlier screening. We also do screening in patients who have a medical history or are on certain medications that could increase their risk of low bone density. And that the ones that come to mind most commonly are patients who are on chronic steroids.
So, Dr. Meister, you're told you have low bone density. So we touched on it a little bit with Dr. Calendar-Rich, but what is your advice to help rebuild that density?
Yeah, so generally the first thing that we talk about really is making sure that we're doing lifestyle things that can be really helpful. So incorporating regular physical activity, especially weight-bearing activities, making sure that we're having a nutritious diet, particularly with enough calcium and vitamin D, either through dietary sources or supplementation if needed. And then making sure we're avoiding some of those not so good habits like smoking or excess alcohol intake. And then for some women, there is an indication to begin a medication. We can talk a little bit about hormone therapy, which can work for some women, and then other women, there are other medications that are indicated to help improve bone density.
All right, let's talk to our two guests who recently had a DEXA scan. MJ, we're going to start with you. Why were you sent to get a DEXA scan?
Well, my experience was part of a wellness, just a wellness check, and I went through a number of tests. The bone density scan was one of those. So it's to establish a baseline, really.
So was the scan itself pretty straightforward, painless? Was it easy to do? Tell us what it was actually like when you were in there.
Yeah, I had no idea what it was going to be like, but the photos you just showed were very accurate. That's what it was. And it's painless. You're just on the table. And the technician was really great at telling me exactly what she was measuring because it's sort of stop and go. They test an area and then update it in the computer. So she was great, and I learned a lot about it, and it was painless.
So what'd they find?
They did find osteopenia, which when they called me with the results, I didn't really get an explanation for what that was. So, of course, I called Dr. Meister because I can do that. But then my doctor's office called me back and also gave me a really great definition. It's pretty common, as you just said, in my age. That's what they told me, and I'm fairly active. One of the things that happened is they doubled my vitamin D and added a calcium supplement to my diet.
Were you surprised when you heard that? And yeah, I would have had to call Dr. Meister too, because I had not heard that term yet, osteopenia.
I was surprised, and I didn't exactly get the definition. So the phonetic description of it. So I was like, what? And I know they didn't say osteoporosis. So yeah, I was surprised, but I was going through all of these tests. So I was just hoping and praying that everything would be a positive. So this did not seem to be that worrisome to me at this point.
So you changed some of those vitamin intakes, but any food changes that you made?
I'm a lot more conscious about it. I've been on a healthy eating plan for many years, but I'm really thinking about it now more than I have been recently. So more greens and just more vegetables all the time, and I love that. So it's good.
All right, Connie, you are up next. You also had a DEXA scan recently. How is your overall bone health?
Well, I had been diagnosed with osteopenia in my 50s. I had a DEXA scan after a hysterectomy. And so I had been on calcium and vitamin D, and this current DEXA scan showed a little bit of deterioration since my last one in, I believe it was 2017. But I still am considered having osteopenia.
And you are a very active lady. Tell us a little bit about all that you do.
Well, I walk for fitness, and so I recently, 3 years ago, I had knee replacement surgery, and after that, and I was feeling well, and I was doing 4 miles 4 days a week, and I garden, so I'm outside a lot, and my husband and I like to play golf when we have time. I've had to cut back a little bit on my walking because my right knee now is giving me problems, and I'm going to have that replaced after the first of the year. But I love to stay active. I love to be outdoors, and want to maintain that.
Well, and that sounds like music to Dr. Calendar Rich's ears, because that's exactly what she's talking about. Yeah, doing weight training. Is that something that you do, weight resistance, to help with bone density and health?
I haven't since I did meet with a trainer probably about 1.5 years ago, and he gave me some really good resistance exercises to strengthen my quads and things like that, but I haven't been able to do those recently because of the knee pain. And I'm kind of embarrassed to say that I have put off using upper body strengthening weights, but as I struggle to garden effectively, I know that I need to do that to be able to wield the shovels the way I want to.
Well, no need to be embarrassed. You just listed off a ton of things you do that very few of us do on a daily basis. And I'm sure behind you in those cabinets, there's probably some can of beans or something, Dr. Calendar Rich, you could grab onto. So I think you're doing everything right. Have you been taking any vitamins or medicine for bone health?
After this last DEXA scan, I was prescribed a medication to take once a week to increase my bone density. But since I was first diagnosed with osteopenia, I have been taking calcium with vitamin D, currently 1,200 milligrams a day, and that's all.
Well, I want to bring our doctors back in just to talk about treatments. MJ is taking vitamin D, Connie is taking calcium plus some estrogen. Dr. Calendar-Rich, does that sound about right?
Absolutely. You know, we want to be sure that people have the right building blocks for their bones to rebuild. You know, we talked about that cycle of breaking down and building up of our bones, and the bones need vitamin D to make to let the calcium work. And so taking some vitamin D, many of us can get it through our diet, but it's never wrong to have, I shouldn't say never, it's rarely wrong to have, you know, a little bit of extra support for those bones. So somewhere around 800 units of vitamin D and 1,000 milligrams of calcium is a great supplement to take.
Never hurts.
Yeah.
Dr. Meister, let's talk more about hormone replacement therapy, or HRT. This is one of your special areas and expertise, and also in research. Who's a candidate for hormone replacement therapy?
So really, hormone replacement therapy is used as a treatment for vasomotor symptoms of menopause, those hot flashes, night sweats that women experience during the menopausal transition, with sort of the secondary benefit to improving bone health. And there are several estrogen formulations on the market that are FDA approved for prevention of osteoporosis. Importantly, there are no hormone replacement therapies that are approved or used for treatment of osteoporosis. And we don't generally consider hormone replacement therapy to be an intervention only for bone health. It's really indicated for those other symptoms with the added benefit of bone health.
And I understand hormone therapy can come in many different forms. You've got pills, patches, creams, injections, quite a menu of options. How do you know which ones to use?
It can be confusing. There are a lot of options available. Generally, I recommend going with the FDA-approved formulations, and those are either oral, so the pill form, or transdermal. And usually the transdermal form is in the form of a patch. When we talk about creams, usually we're referring to estrogen cream that's used inside the vagina, and that's more of a localized treatment for vaginal health, but that is not systemically absorbed to a significant degree, and so it's not useful for bone health, and it's not really useful for those vasomotor symptoms. So when we're talking about systemic hormone therapy, usually we're talking about the patch or the pill.
So I wanted to ask Connie, is your estradiol pill, or your treatment, is that in a pill form?
Yes, ma'am.
And when did you start hormone replacement therapy, Connie?
I had a hysterectomy when I was in my mid-50s, and I was on hormone replacement prior to the surgery to treat my symptoms, and then after the surgery, of course, to compensate for the effects of the hysterectomy. I went off probably 10 years later, and I was having extreme difficulty sleeping once I went off the hormone pills. So my gynecologist, bless his heart, prescribed the estradiol, a very, very low dose of the estradiol, and that was a lifesaver for me at that time. And so I've continued to be on it because I haven't, there's been really no reason to stop. I just have reduced my dosage over the years.
So Dr. Meister, when should someone start and stop HRT?
So really, we want to start hormone replacement therapy as close to menopause as possible. And again, that's to treat those menopausal symptoms. And generally, the recommendation is to start before age 60 or within 10 years of menopause. There are some increased risks, particularly in the form of stroke or blood clot, that can occur in women who don't start their hormone therapy until later in life. So we generally do not start it much later than age 60 or within 10 years of menopause. The question about how long to continue is a very can be very variable depending on the patient, and typically I recommend talking to your doctor about how long to continue. Usually about 5 to 10 years is ideal for hormone replacement therapy, although there can certainly be indications for extending the duration of therapy. As Connie noted, anytime you come off of it, most women do experience some symptoms. So there are ways to taper the dose so that hopefully the experience of those symptoms is minimized. But most women do experience some, hopefully mild symptoms as they begin to taper and discontinue the hormone therapy.
So MJ, you've got a daughter. What kind of advice does she give you regarding bone health or any health at that matter? I'm sure she treats you like any patient, but maybe you have a little bit of a streamline straight to your doctor.
You know, I don't think it's necessarily the advice she gives me. I think it's the way I ask the questions, because I'm just really free to ask exactly what I want to know. And she sounds very much like she is on this video.
Yeah, what's it like to hear her on this program as a mom, just doing her thing and sharing her research and her information?
Well, you know, they all work very hard. She has come up through a fabulous program, and being at KU just has great colleagues around her. And so just watching all of them, I'm just so impressed with the doctors that are taking on women's health. It's just really good to see. So, yes, of course, we're both proud of her, but it's just great to see that impact on healthcare.
Absolutely. Dr. Calendar-Rich, you mentioned a little bit of this before, but I don't think we can mention it too much. Talking about smoking and alcohol being related to bone health. What do we know about that?
You know, we know that excessive alcohol and smoking really puts a lot of stress on the body. You know, and any kind of added stress really can make it hard to create those building blocks, right? We talk about building blocks for the bones to grow. We also talk about in different places of our body building blocks for other parts of our body to function. And we know that excessive drinking and also smoking really can impair that ability to happen.
All right, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's get a quick check on our COVID count. Dr. Dana Hawkinson, good morning.
Yeah, hi.
Hi.
Nice rainy Monday,
Ugh.
which
Yeah.
we need the precipitation. We need the rain for sure. So, yeah, right now at the health system, unfortunately, our numbers went up a little bit. We have 24 active inpatients, up from, I believe, 16 last week. So again, heading into a holiday weekend, we know the virus circulation in the community in general has been high. Unfortunately, right now we have high numbers in the hospital as well. So I think it continues to be important to emphasize to people, number one, get your updated COVID vaccine if you haven't, and have a plan in place as well. You are always okay, and it's always safe to wear masks, but just have a plan in place for if you do have symptoms. You may have to test multiple times on multiple days for COVID to have that positive test with those at-home tests, and just be always ready to contact your healthcare provider about getting on those oral antiviral drugs as well.
All right, Hawk, I want to talk about an issue that's super important. We hear about this quite a bit, but it's about antibiotics and germs that resist them, and an issue that I think a lot of people have and what they've heard, so I kind of want to understand this. But talk about how serious of an issue it is with antibiotic overuse.
Yeah, I mean, certainly it is prevalent in our daily lives as far as things that we don't even know about. We know that food production, such as animal farms like chickens and beef farms, use a lot of antibiotics to help keep their animals healthy so that they can go to market and, of course, end up on our plate. Well, that also puts a lot of antibiotics into the environment in general, just through excretion. We know it can be found in the soil. We know they can be found in our wastewater and in our rivers as well. And then we ultimately may consume those in that way. That it just allows for our bodies and the bacteria in our bodies to have a little bit of contact with antibiotics, a little bit of exposure that will help drive antibiotic resistance in our bodies. The other important thing that I think most people understand is that we take antibiotics. So things like coughs and colds, we know that antibiotics are overprescribed. We know that the vast majority of respiratory illnesses like cough and colds are just viruses, and if you give them say 7 to 10 days, you are going to be feeling better. But we know that people after 1 or 2 days will go to their doctors and demand an antibiotic like a Z-Pak. So it's really, this was a proclamation that was signed by Governor Kelly for the state of Kansas, but in general in the nation, we have Antibiotic Awareness Week. It started on Saturday, it goes to this next Saturday, and that's just to help promote education and let people understand that for the most part, there is a large overuse or overprescription of antibiotics, and it is very important to have those specific conversations with your physician, not just go in demanding antibiotics, but just understand why and why not we are prescribing. And we want to prescribe antibiotics when you need them. But there are a lot of cases, especially in the outpatient, the ambulatory setting, or the clinic setting, when antibiotics are not necessarily needed. And so it just goes to help understand that. In that way, when we need antibiotics, we have them to use, because we are hoping to decrease or stop the fast spread of that antimicrobial resistance for those bacteria and those antibiotics.
All right, Hawk, thanks so much for that. Let's get to some questions from our viewers. Sarah wants to know, how much vitamin D can we get from sunlight? Is there a way to even really measure it, or do we just know being out there and about there? Connie says she spends a lot of time outside. Do we just know it's good to put into our routine?
Yeah,
so it's happening.
Sure. So everybody absorbs vitamin D a little bit differently. We know that people with lighter skin may absorb it more quickly, and people with darker skin may absorb it more slowly. It's hard to really quantify. We also know that the more time you spend in the sun, great for vitamin D, but balancing that with other risks of being out in the sun, and many of the things we do to protect ourselves from the sun actually prevent the absorption of vitamin D. Things like certain clothing that we may wear, or even some sunscreen. So, really the only way to know exactly how much you're getting is to be taking it by supplement. The other thing to that is not everybody absorbs it the same. So your doctor can certainly, if they see a reason or that you're at higher risk, they can certainly check a vitamin D level, and many people will do that when a person has an abnormal, like, bone density scan, or if they have a fracture of some kind. But long story short, it's not easily quantified.
So Joe Ellen has a question. I've heard pros and cons regarding medications like Boniva. One might even cause loss of bone in the jaw. Just thoughts on that, and just certain medications, and we hear that it's good for you, but are they really?
Yeah, so every medication is going to have risks and benefits. And certainly some of those medications that are out there to help treat osteoporosis, like Boniva and others, have some risks of damage to some joints, especially, there is a lot of publicity out there about some damage to jaw joints. It happens very rarely. If it happens, it is a big deal. But again, it's very rare, and the benefit of having stronger bones, and if you fall, being at much lower risk of actually breaking something, in most cases, that benefit is going to outweigh that risk.
So Jean has a question. Dr. Meister, when comparing bone density score to an average younger healthy person, how do you know if a person has lost bone density, or if that person has just always had less than average bone density?
That's a good question. We don't really quantify it that way, or do comparative scores, especially because we don't usually measure bone density until someone is older. But that's sort of the purpose for the standardized score. So we know that sort of where the patient falls in relation to a young, healthy person, and that can give us some assessment or some measure of their risk of sustaining one of those fragility fractures or osteoporotic fractures, and help us guide recommendations for their management from there. So we don't really do a lot of comparative analysis aside from generating this standardized score to help us know how to proceed and counsel patients.
Dr. Meister, Judy wants to know, how do I get an appointment to get this scan?
That's a good question. I would start with your primary care doctor or any other provider that you see regularly. Any doctor can order the test, but really it's very helpful to go through a primary care physician, or if you see an OBGYN regularly for annual visits, because then that person can get the results of the test and help you interpret the findings and make recommendations for next steps. So like I said, I would start with your primary care doctor or your general OBGYN.
All right, Dr. Meister, let's stick with you and get some final takeaways today. What do you want folks to know?
So, like we've been talking about, really bone mineral density decreases rapidly during the menopausal transition, but there are a lot of lifestyle factors that can be helpful and sort of set you up for success with the best bone density to start with. And so being mindful of those lifestyle factors is really important. And certainly if you are experiencing any symptoms of menopause, you might be a good candidate for hormone therapy and should talk to your OBGYN or primary care doctor.
Connie, what's the takeaway?
It's important to me to do everything that I can to stay as healthy as I can for as long as I can. And this is just a part of it, and it's so easy.
Great message. Thank you for that. MJ, what is the takeaway from your experience?
Well, I've just enjoyed listening to this panel and both docs and learning a lot more about the osteopenia diagnosis. And also, I think I have to start lifting weights again.
Doctor's orders. Thank you so much, both of you, thank you for coming on and sharing your experience with us and getting that scan. Dr. Calendar-Rich, what's the takeaway today?
I mean, I think I always have the same takeaway. We all need to move and groove.
I love it.
We need to get up and get moving and stay moving. And part of moving is really maintaining your bone health and your muscle health and lifting weights with resistance.
Good to see you. Yeah. Thanks to all of our guests today, and thanks for being with us, to our viewers and your great questions. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Jennifer Osorio went for an elective surgery. Surgeons spotted something concerning inside of her. I'm Jessica Lovell on the next Morning Medical Update, discovering cancer just by chance, plus the treatment that had Jennifer swallowing radiation. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.